Okay.
5 seconds left. Right, so if you have read and understood considering it communication skills station, can you please begin?
Hello, it's Mohammed Sherbini, the SHO in charge, working for Mr. X. I'm calling to speak to Mr. X to ask him some advice for a patient who had right hemicolectomy for cecal tumor. Could I check that I'm talking to Mr. X?
Yes. Who is the consultant of the case, please?
Okay, from the patient note, it is Mr. X.
Okay, summarize your case, please.
Okay, this old lady who is 69 years old has been operated for or was operated for a cecal tumor by right hemicolectomy 24 hours ago. The problem is that the patient is oliguric now. The urine output of the patient is about 10 to 20 milliliter per hour. I have checked the urinary catheter of the patient, which wasn't blocked. By clinical examination of the patient and assessing vital signs, the patient is tachycardic with mildly hypotension and low-grade fever. I have examined the abdomen of the patient, which is soft and lax. I have arranged some blood for the patient, which revealed that hemoglobin level has dropped from 12 to 10, with slightly elevated urea and creat.
Okay, what do you think the cause is?
Actually, I'm thinking the cause is dehydration. I think the patient is dehydrated because regarding the fluid chart of the patient, she only received 1,100 milliliter of normal saline, and the urine output is about 10 to 20 milliliter only. There was loss of blood during the operation, but she received 2 units of blood.
Okay, what plans of action will you suggest?
Okay, regarding this patient who is a critically ill patient, I'd like to start a crazy protocol for the patient by assessing her airway and breathing and circulation, and start to resuscitation of the patient by fluid challenge, which will entail 5 milliliter per kg for 15 hours and for 15 minutes. Then I'd like to give her fluid maintenance dose by 1 liter of crystalloid over 1 hour. Then I'd like to check the response of this fluid challenge for the patient overnight. If the patient is not responding to the fluid challenge, I'd like to transfer her for a high dependency unit for inserting central venous line and monitoring and assessing the fluid response. I'd like also to arrange for some new bloods by the morning of tomorrow to show hemoglobin level of the patient. If the hemoglobin level more dropping, I'd like to consider blood transfusion.
Okay, do you think the patient is bleeding?
Active bleeding is a possibility, but till now I have to wait and do more serial abdominal examination and assessing the vital signs of the patient closely.
Okay, do you think this is an anastomotic leak?
By clinical examination, the patient is not toxic, no signs of peritonitis. There is no guarding or rigidity of the abdomen. I have examined the abdomen, and which is soft and lax. But I'm going to arrange for ultrasound for the patient until let you know about the result when it's available.
Okay, you said to me you checked for the labs?
Yes, I will wait for the result of the ultrasound and let you know.
Okay, I'm talking about the labs. When the labs were done, you said that the patient hemoglobin drops. When the labs were done?
Actually, I will revise this from the notes and let you know about this.
Okay, regarding ATLS protocol, do you have checked for the exposure of the patient?
I have exposure to the patient for looking for any painful swelling of the patient, painful swelling leg or signs of DVT of the patient.
Okay, if the patient is wearing TEDs?
I'll check this from the note and let you know about this later.
And what if the patient is not wearing TEDs?
Actually, if the patient is experiencing any signs of DVT, such as painful swelling of the leg or saturation has been deteriorating, I have to consider assessing the patient and clinical examination of the lower limb vascular examination and order venous duplex of the patient. If I'm suspecting DVT, I will prescribe here low molecular weight heparin.
And TED stocking. Good.
Into the stocking, yes. Okay, if you need me to come back for you.
Actually, I will follow the response for follow the challenge and let you know subsequently.
Okay, that's good.
Okay. Anything to add?
Yes. Do you need the patient? Do you need to transfer the patient to HTU?
If the situation of the patient has deteriorated, or if there is no no response to fluid challenge, I'd like to transfer her to HDU.
What would
If
you do
if there
if
is
HTU is full? How would you manage the patient? Yes, during that
if it's
time.
full, I will monitor closely monitor the patient in the ward till there is a bed available for her.
And you'll talk
I
to the
can
bed
improve her
manager.
saturation level by giving her oxygen, hemophied oxygen by oxygen mask and reservoir bag.
Good. And you'll talk to the bed manager and you'll arrange it. Okay.
Okay. Mhm.
What do you think might be the cause of shock in this patient?
In the fact that the patient lost blood during the operation, I think hypovolemic shock.
Okay.
Maybe كده core. Yes.
Right. Who would you involve in the management of this patient?
Okay, I'd like to involve the surgical consultant who I'm calling to him right now, and I'd like to involve HDU registrar.
Yes.
And what else?
Maybe nephrologist,
Mhm.
because urea creatinine are high.
Okay.
Yes. And
Mhm.
okay, you can carry on with the suggested plan of action that you have discussed with me, and then you can get back to me when the labs are ready or available.
Okay. Thank you.
Good. All these stations that you are presenting, they are of giving information. So how
This
these,
communication.
yes, these communication stations that we are discussing. 10 seconds, 9 seconds are left. That's why I'm just waiting for the bell to go.
Okay.
Good. Right. Thank you.